I certainly share the vision that healthcare needs to change, and I've been working within the system for the last 20 years. I'm very involved in trying to help change medical education and training to an integrative model. At the core of that being self-care and having each practitioner understand what they themselves need to do to achieve the state of calmness. It's very difficult to tell a patient what to do and give them advice if you yourself are in turmoil and do not practice self-care. It's easy to treat the superficial symptom but get to a deeper level. It's more difficult. Part of the problem with physician practice, though, is they're not mentored to value fundamental lifestyle, which is the core of health. Unless you're taught to value it within yourself and to value it as relevant to patients, you're not going to practice it. So when doctors get out into practice, they're actually not pursuing this, and they don't think it's important for the patients. So I think that the training and what's done in mentoring in medical schools needs to change in it. I think that physicians feel very burdened. The average time to interruption of the patient by the doctor is 18 seconds. The average time that's spent with a patient is 7 minutes in a managed care system. I think that there's systemic issues with malpractice, with managed care, that are pose grave difficulties, and even the threat to the practice of a physician, to the point where the majority of primary care physicians would not recommend that their children become physicians. But within that, I feel blessed to be in this profession, and having the heart of healing as the focus of your practice is dramatic. Even within a 7-minute visit, you can do so much to help your patients. The problem is that most of them haven't been trained and don't have the tools, and we need to help them to get back. Most every physician went into medicine really not for the money. They went into it really out of altruism, like nurses do. And along the way, it gets corrupted and they get burnt out. And we need to give them help to come back into the fold and feel the inner essence of healing that they wanted to explore when they first went into medicine.